Perfect. Okay. Thank you very much, everybody, for joining us today. And today we are chatting to Dr. Matabise. And Dr. Matabise is from Cape Fertility Clinic. And it's always good to have one of you guys on and also to talk to Doc. So for those who didn't know, I've actually been to Doc. I've actually been a patient of hers a few years ago. So it's always great to talk to you. And thank you again for taking your time out to join us and do this talk to help educate women when it comes to dealing with infertility and the different options they have available. Thanks, Doc.
Thank you so much, Leanne, for that very kind introduction. And thank you once again for inviting me. And hello to all the listeners. It's always such a pleasure to come to this platform to share information, to make sure that the knowledge is out there and that no one is left out. Yes,
absolutely.
So I'm happy to take your questions, Leanne.
Okay, so today's topic is ICSI. So we're always hearing about IVF, and then here and there you'll hear about ICSI, but what is the difference? So our first question, Doc, is what is ICSI? Could you just unpack that for us, please?
Okay, yeah. No, thank you for that, Leanne. So ICSI basically is an assisted reproductive technique. Yeah, so ICSI just is an abbreviation, and what it stands for is Intracytoplasmic Sperm Injection. I know that sounds like a mouthful. So basically, all it means is that, it refers to, when you take an egg and you inject a single sperm, so that's the injection, directly into the egg with the aim to increase the chances that the egg will fertilize with the sperm. Yeah.
Okay.
Yeah. So, and the interesting thing about this technique is that it was actually discovered accidentally, which is quite interesting. So one of a professor in Brussels, the student was working in the lab and he accidentally injected sperm into an egg and they got a beautiful embryo. So embryo would be the early stages of the baby. So that's how it actually came about. And then they started to, to perfect the technique. Yeah. So, so it's really, it's similar, but, it's really indicated mostly when they, for when there's a problem with the sperm. Yeah.
Okay. So when, okay, so that was actually my next question, but when is ICSI indicated?
Yeah, so ICSI, so, when we look at these treatments, we look at what has been studied properly. So you would find nowadays that most clinics are just doing ICSI. So basically it's similar. So, for a woman to have the ICSI, they still have to go through, the couple still has to go through the IVF cycle, where there is actually the stimulation of the ovaries for the eggs to grow. The eggs are then retrieved, in theater under sedation. And then the eggs are worked within the lab, so that we can then put sperm in them to fertilize. Yeah. So the main indications, or those that have been proven to really increase the life birth for ICSI, is when there's a severe male factor. So what do I mean by that? So I mean, when we assess the sperm, or the embryologist assesses the sperm in the lab, if they see that the sperm count is very low, so we're talking about sperm counts of less than 15 million per mil. If the morphology, which refers to the shape of the sperm, because we must remember only the sperm with the normal shape is able to fertilize an egg. If that is also very low, so most of the sperm has got poor morphology, or even the movement of the sperm is low. So that's when it's more helpful to inject a sperm directly into the egg. So that's the main indication. The other indication is for men. So I'm sure we've all heard of the term azoospermia. That just means that the man is ejaculating, but there's actually no sperm in the seminal fluid. And that could be because there is obstruction. So with these men, the body or the testis is actually making the sperm, but there's obstruction, maybe because of a previous trauma or the previous infection, and the sperm is not actually able to come through so that we can pick it up in the seminal fluid. Yeah. But then those men then require a small surgical procedure. So you actually retrieve the sperm directly from the testis. Yeah. Okay. So that's called a testicular biopsy. So that sperm is not really suitable for conventional IVF. You can't just inseminate it. So that sperm then, has to be processed in the lab, and you have to inject each sperm directly into the egg. So that's one of the main indications of ICSI. And then the other indication would be if the couple has done conventional IVF and there was no fertilization of the eggs, or very poor fertilization, then you need to up to the ICSI. And then, you know, nowadays, like I said, people use it for other things that are not proven, like unexplained infertility. So let's say, you know, let's do ICSI to improve the chances, not necessarily true because that's not proven. Or if you're working with frozen eggs, because, you know, the frozen eggs, sometimes there's structural difficulties for them to fertilize. So you might want to do ICSI, or also for older women as well. Yeah.
Okay. Wow. Okay. So because I always thought, I'm glad you touched on the topic where you're talking about azoospermia. Is that the correct term?
Yes.
Because
yeah,
because I'm always hearing about, you know, men would contact us and say, you know, that is their problem, and what would be the next one. So I'm glad that is exactly how it was done, that you actually explained that to us. That's great. What is the difference between IVF and XC?
Yeah, so, you know, it's always very difficult to explain that because, you know, sometimes people use the two terms interchangeably, but that's not actually correct. So basically, IVF means in vitro fertilization. So if you think about it, all it means is that, you know, the eggs have to be taken out of the body, and then the fertilization of the eggs happens in the lab. Yeah, so that's the meaning of IVF. So basically, then there's two methods that are being used at the moment to cause the eggs to fertilize, if I can simplify it like that. So I'll speak of the first one is conventional IVF. So that's basically what was done before advancements when ICSI was available. So as you know, the first IVF baby was born in 1978. And back then they were just doing what is known as conventional IVF. First ICSI baby was born in 1992. So that's basically means that there's been improvements in what's happening in the lab. Yeah, so conventional IVF, to simplify it, then it means once the eggs are retrieved, they are put in a dish in the lab, you know, under special circumstances. And then, you know, they are put in what we call drops or droplets. You can put about 3 to 4 eggs per droplet. And basically then what that means is that the sperm is processed. So we talk of it as washed. So it means you remove all the dangerous stuff in the sperm, the fluid, so that you're only just working with a clean sperm. And then a certain amount, which is measured, so a specified volume of sperm, is then just inseminated around each droplet. So to simplify it, basically, is you take the eggs, you put them in a dish, and then put some sperm around all the eggs. So just like this. So that would be conventional IVF. You then culture that dish in an incubator overnight. And then the next day, you then clean the eggs. So that means you remove the outer shell of the eggs. And then the embryologist looks under the microscope to see if the eggs have fertilized. So that's conventional IVF. So basically, it's mixing the egg and the sperm and waiting to see what has happened the next day if you've got fertilization. So the risk there, of course, is that if the sperm has got poor morphology, you might find that, you know, there's been no fertilization at all. Yeah, so that's the risk you take when you do conventional IVF. So ICSI is a more refined technique in that. So with ICSI again, so it's the same process, you know, the eggs are retrieved, and then the difference is that now the eggs are cleaned before you put sperm in them. Whereas with the other process, you first mix and then you clean afterwards to check if they're fertilized. So with the ICSI then, So with the ICSI, you clean the eggs and then they make sure that the eggs are mature. So you can only work with mature ones. So they look for what we call a polar body. So you work with only the mature eggs. So you also tend to lose some of the eggs already from the start because some of them might be immature. And then they use a very, you know, intricate technique in the lab. So they'll look under the microscope. They'll take under the microscope, they'll take one sperm. So they pick a normal shape sperm, so to increase the chances. And then that sperm, the needle is pushed into the egg directly, and that sperm is deposited inside the egg. And then, so you do one egg at a time, so it takes longer, and then you leave your eggs again overnight, and then after 16 to 18 hours, you check for fertilization. Yeah, I hope that's clear, Leanne.
Yeah, no, really clear. I'm actually just picturing it. So perfect. Okay.
Yeah, it's a pity I can't show you pictures. It's more interesting if you see the pictures. Yeah.
Okay.
But if you go on our website, you can see them. Yeah.
Yeah, I've actually seen a small video of it. So I was actually, as you're explaining it, I was actually just picturing exactly that going in and doing that happening. What is the success rate and the difference between ICSI and IVF?
Yeah. Okay. Yeah, that's a very important question, Leanne, because there is this wrong thinking, if I can put it like that, to say that, you know, that when we counsel patients, we say, you must do ICSI to increase your chances of success, and it's better than conventional IVF. So that's not necessarily true. So there's been a lot of good quality studies that have been done, which have actually shown that if the sperm parameters are normal, the fertilization rate is actually the same, whether you do conventional IVF or whether you do ICSI. So where ICSI comes in is that it increases the fertilization rate, like I said, if there's sperm abnormalities. So that's where it's indicated. So ICSI is about fertilization, not about pregnancy rate, not about live birth rates. Once the eggs have fertilized, then the success rate really is the same in terms of, you know, the pregnancy rate and the live birth rate. And as we all know, that depends on various factors, and the most important one being the female age and the quality of the eggs. Also, there's uterine factors involved. So, you know, yes, for men with severe male factor infertility, then you can confidently say that you will increase their chances of success by doing ICSI. But you can't tell that to all couples. If the sperm is normal, by doing ICSI, you're not necessarily increasing the chances of success.
Okay. And what about cost, the difference in cost between the two?
So ICSI tends to be more costly. So already, you know, for an average IVF cycle, I would say maybe 60 to 70,000 rands. Some clinics I know even add an extra 17,000 rands if they do ICSI. So that's why, you know, most of the regulatory bodies are saying, and we are saying, we should be careful when we do the ICSI and about how we counsel our patients, because ICSI is costly. So when I was explaining the techniques, I was actually trying to make the point that, so ICSI, firstly, you need more resources in the lab. So you need specialized equipment. You need those ICSI needles. They cost quite a bit. You know, we're talking thousands of rands. You need those micro manipulators, you know, that they use to move the eggs around so that they can inject. You need more dishes, because you remember with conventional IVF, I said you can put 3 or 4 eggs in one drop. You need to work with one drop, one egg, you know. And then also you need experienced embryologists. So basically, even your lab staff, in terms of, you know, finances and how much the lab staff is being paid, it's more. So, you know, when you're doing ICSI, basically, it does tend to make the IVF treatment then more costly. Hence, you know, one has to be careful about the ICSI for all, you know. Having said all that, you know, I'll again also be the devil's advocate and then say also then one can look at the other side of the coin. So in countries like ours where there's no funding for IVF, so one, you see, the reason some people then are just resorting to ICSI is that there is this fear. So a couple who's now saved up for the whole year, they come and do IVF. You do conventional IVF, there's no fertilization. You know, that's the end of the cycle for them. You know, some people do what is called rescue ICSI. The results are very poor with that, So, you know, there is thinking. So that's why most people do that, because, you know, there is this anxiety that what if you get no fertilization, then everything is lost. So, you know, costs. So one has to look at both sides of the coin. So,
that actually leads me to a last question. We don't have that down, but is it okay, or would you do it if a couple comes in and say, we actually just want to do, we've never done IVF, the conventional IVF, but we just want to straight go to ICSI? Would that be okay? Or would you first tell the couple, advise the couple and say, no, first do an IVF, a normal round of IVF, and see what we're working with, and then do ICSI?
That's a very interesting question, a very good question, Ian, and a very difficult one to answer. So for me, I would say, provided the couple is fully counseled to say that by doing ICSI, so they might be making their cycle more expensive, they are not necessarily increasing their chances of success, but at least then they might be helping themselves in that they're increasing the chances of fertilization and eliminating, or not eliminating completely, but reducing the risk that we might not have any fertilization. So, you know, the short answer then is I would probably allow it, provided they're fully counseled.
Okay, awesome.
Because it would be difficult, because you say no and then there's no fertilization, then it's a big problem.
Yes. Wow. Okay. Thank you very much, Dr. Matabisi. That is so informative. I actually do understand the difference between ICSI and IVF, because again, you know, when you're talking to somebody about IVF and then you're talking about ICSI, and everyone's on they all think it's the same thing, but we really got a full breakdown of exactly what it is. So thank you again for taking your time out to do this. And if you have any last words for the ladies.
Yeah. Okay. Yeah. And then just to wrap up again. So, the other question that sometimes people ask is, are there any risks? So, I spoke about that, the fact that I would counsel the patient. So basically, when you're doing ICSI, so that's one thing I would mention. In fact, just to add on to the question that you just asked me now, to the couple that you see, when you do ICSI, there is a small risk of damage to the eggs because you're you're manipulating the eggs more, you're putting an actual needle into the egg. So actually you can damage. The damage rate is not high. So most regulatory bodies say about 5%. Here at Cape Fertility, we have only a 2% damage rate. But you see, it's easy to say that, but if you have 2 eggs and you damage 1, you're left with 1. So then you want the argument, the counter argument is that, perhaps it wasn't the right thing to do. Yeah. So basically for me, what I would say to everybody is that, it's good to research as well. So yes, we know that Google is not the best source, but I think it's nice to listen. I'm glad we actually have, you, Leanne, and Fertility Solutions, and actually running these talks, because I mean, most of my patients actually tell me that they listen to them. And that they learn a lot. Yeah. So it's helping us a lot, because by the time we see ladies, they've got some background information. Yeah. And then I would also like to tell all my patients, please don't give up. You can do this. It's a difficult journey. It can be painful, but it can come to a happy ending.
Awesome, that's great. So if you guys know Dr. Matabisi, or if you are at Cape Fertility, she's at Cape Fertility. If you want to get in contact with her, you can contact capefertility.co.za. You can go to their Facebook page. Maybe you just want to mention your email address, doctor?
Yes, my email address is tmatebese@capefertility.co.za. Or the best, actually, if you go, as Leanne has said, on www.capefertility.co.za, and then all our profiles are on there, including the email addresses for our PA. So it's easy. And I don't mind answering emails. You don't have to be a patient of mine for me to answer a few questions for you.
That's so great. I'm loving the fact that you got all the babies in the background, doctor. And that's just like hope for all the ladies out there. So guys, look at the photos in the background. But thank you again, and have it's great chatting to you, and we hope we can do this again soon, doc.
It's my pleasure, Leanne, and bye everybody. Afternoon. And thank you for listening. Bye bye.
Thanks. Bye.